Okay, we're back. So now let's see now. Cohen and colleagues recently examined the prevalence and common causes of dysphonia as diagnosed by primary care physicians versus otolaryngologists, and found that they were different, which probably is not a surprise, is it? 1% of patients received a diagnosis of dysphonia, 1 out of 100. It's not an overwhelming number. Females twice as likely as males. Think about that for a second, about why that might be. Older adults, that's even older than me, were 2.5 times more likely than those under age 70 to be diagnosed with dysphonia. Anybody having any thoughts about females versus males? I mean, there may very likely be real biological reasons for it. It may also be, like, what do you consider to be a dysphonia? I think if a male has kind of a mildly raspy voice or something like that, we may think of it as quote unquote manly or kind of macho or who knows, you know. We accept it. Females tend to have certainly higher pitch, thinner voices, less likely to be abrasive or hoarse in any way. So maybe that's a bias in a general physician diagnosing a female as having a voice disorder as opposed to a male. Depends what norm is. Okay. The most frequent diagnoses that were given was either acute laryngitis, in which case it was something that probably is accompanied by an upper respiratory infection, a more general one. Non-specific dysphonia, meaning that it's not accompanied by anything else. Benign vocal fold lesions, which I'm sure would not have been given by the primary care physician, but only by the ENT. And chronic laryngitis, just because the patient would have reported that they tend to have it often or always. Okay. All right, so here's some interesting numbers. The prevalence decreased slightly after age 9, so that up until 9, you have a higher number, and then it dips, and it doesn't come back and peak again until the age of 30. So that would mean that, and again, I don't really know, well, I haven't met any of you yet. My guess is just because you're graduate students, and if you are kind of, and I hate to use this word, average graduate students, you're all above average, extraordinary. In fact, I'm sure of that. But in terms of age, it's likely that you're somewhere in that gap between 9 and 30. Not closer to 9, closer to 30. Hate to tell you that. And some of you may be older than that, I don't know. But you're in that kind of honeymoon age of 20 years or 21 years where it's not so likely that you have a voice problem. But then as you hit 30, if you haven't done that yet, it becomes more and more and more likely that you are going to develop some kind of a voice disorder. Okay. If you look carefully at the 0 to 9, if you look specifically at that, males have a higher prevalence than females. So I guess what we were looking at before is either general or adults, right? And females had a higher prevalence beginning with puberty and persisting until age 70. So older people, from teenage on, females more likely. But the school kids, it's much more likely that it's a boy than a girl. Okay. Okay. Cohen reported that those who had a diagnosis of dysphonia received medical treatment for 12 months or more. That's a long time. A long, long time. It's not being specific at this point, at least, what type of medical treatment, but that's a long time to be under medical care for a particular diagnosis. And we're not talking about cancer, and we're not talking about heart disease. We're talking about having a hoarse voice. Okay. Okay. Now we're looking at monetary cost. Okay. The annual direct costs ran into hundreds of millions of dollars, which is comparable, literally, to other far more serious, life-threatening diseases. Although when you look at it by month, you know, I mean, not that that's, you know, whatever we call chump change, that's expensive, that's money, but certainly not compared to what it would cost to treat cancer for a month or treat heart disease. Okay. And so Cohen was interested in knowing what's going on, and he decides to let's talk to the ENTs and find out what they're doing. And what did it say, 1,000? Yeah, 1,000, and we had a 30% return rate. Okay, 300 responded, and that many of the physicians prescribed, and we haven't talked about this yet, so if this is not clear to you what it is, it will become clear in a later chapter. Controlling laryngopharyngeal reflux was the most common disease. And what does that mean? You know, in layman's terms, take Tums, take antacids, stuff like that. And after that, well, then maybe you should go see a speech therapist for voice therapy. The most common laryngeal conditions leading to voice therapy, not to Tums, were vocal fold nodules. We have a chapter on that coming up. I think it's the second chapter. No, it's the third, actually, as I recall. And muscle tension dysphonia. We're certainly going to talk about that quite a bit. Muscle tension dysphonia is probably the most prevalent cause of voice disorders throughout the population. And again, we haven't defined these things yet, but we will. Okay, so what we're going to do now is we're going to look at special populations. And again, these populations are being looked at, or have been looked at, and continue to be looked at, frankly, simply because the hypothesis is not null. The hypothesis is they're more likely to have voice problems. Okay, so we're going to look at children. Okay, and we all know that lots and lots of children, we already have the statistic that up until age 9, we have a kind of a peak. It's hard to know, to get a really accurate kind of a number. It's important to know. We'll talk in a minute about why it's so hard to find out. But we do know why it's important to know, because dysphonia will negatively affect academic achievement and affect vocational choices later in adulthood. We're not specifying now how that happens. I think it's something for you to think about. In fact, if I thought of that, I probably would have had you put that into your discussion board. Why do you think it affects, or how does it affect academic achievement? What's the difference if I have a hoarse voice or not? It means I don't learn math as well. And how does it affect my vocational choices? I think that one might be a little bit more obvious. But again, something to think about, and perhaps we'll talk about it at a later date. Okay. A conservative number is 6 to 9% of school-age children have a voice disorder. Other studies have 4%, and others would have a much higher number. And so we don't really know. We don't really know. The problem is basically, how do we determine who's got a voice disorder? Do we wait for a referral from a teacher? Do we wait for a referral from parents? If we do all that, it's going to be relatively low. Where not necessarily people are going to be consulted and talked to. If it really bothers a parent, probably the first thing they're going to do is go to a doctor, and we may never see that child because perhaps they were able to treat them without us. And that's what's happened. We're not critical sometimes. We have to remember that. And it could be it's not bothering anybody. You know, it's not bothering the teacher. We get our highest incidence rate when we do the screenings, frankly. We have a more sensitive ear, and I think our criteria are a little bit more rigid and careful. Okay. According to the census of 17, now it's 17 years ago, not when the book was written, which was 2 years ago, 74 million people between the ages of 0 and 18, which is a quarter of the total U.S. population. So if we take these numbers and we extrapolate them, what we wind up with is we have millions and millions of children with voice disorders. Okay? Millions. Not an insignificant number. And we know for a fact they're not getting voice therapy. Okay? We know we're not treating millions of kids. It's not happening. We'd all be rich. But we're not doing it. We're not seeing them. We're not evaluating them. It's not that we've decided not to treat them. We've never seen them. Um, Middle school or high school are children who are always, well, I don't know if they wouldn't like me calling them children, I'm sure. But these people, these young people, don't want to be identified as anything, you know that. And they certainly don't want to be identified as having a voice problem. For guys, it's manly, and for women, probably doesn't happen as often. At that age, they're still young enough that we have probably more males than females, and they're not interested in being singled out either. And so we're just not seeing them as often. So we don't have numbers. Okay. When we look at the elderly, I kind of resent a little bit this definition of 65 and older, but that's what it is. Okay. So the elderly constitute 13% of the total U.S. population, and that number goes up dramatically every single year now. Yeah, I'm sure you've heard this in all your courses that deal with adults. That number keeps going up because people are just living longer. Not necessarily healthier. In fact, for sure, not healthier, but they're living longer. So nursing homes are packed. Okay? And even though we know that there are lots and lots and lots of people out there, and we know that the risk factors are very high, and that dysphonia has a real, not only health, but a psychosocial impact on older people, we know we're not getting there. We don't have good statistics at all. Who's screening those people? Nobody. It's by far, unless we're talking about organic problems that are there, cancer of the larynx, or even medical problems of the larynx. If we're just talking about functional disorders, that's not the most important thing going on in their lives. Most of them are dealing with far more serious health issues and maintenance issues of health. And so voice just takes a back seat. Despite these numbers that I'm not going to review for you now, but we're talking about really tens of millions of people who are not getting treated. So we've got a lot of work out there. Now, given the fact that an elderly person has a greater risk of a voice disorder if they also have a hearing loss, and given the fact that way more than half of all people over the age of 70 have documented hearing losses, different levels of severity. But that's not only, not common and not rare, it's common for a person over the age of 70 to have a hearing loss. And if associated with that are voice disorders, then we've got a lot of problems, or they have a lot of problems that we're not dealing with. Let's put it that way. Okay. We have a different population to deal with now, and that's teachers. There's been a lot of literature on voice disorders in teachers. They are people with a high incidence. What we know, and this slide gives us some numbers on that and gives us a reference if you're interested in this further, and that is people who use their voices more are more likely to have voice disorders. Not because it's not meant to be used. It's not because the larynx and vocal folds aren't meant to be used, but there tends to be misuse of vocal folds. People don't really know how to use them effectively when they're using it a lot. Everybody seems to know how to use their vocal folds to talk and to make voice. But when they're using it a lot, they don't really know how to conserve. They don't know how to use their voice in a way that allows their voices to last and to be effective. Okay, within this group, we have 3 million primary and secondary school teachers, and that's an extremely large number of people in a particular trade. Okay, we're going to stop here because of time. We're again at 14 minutes. I'll see you in a minute.